When we first put out really some of the very first papers that children with cancer were at higher risk of developing heart problems, there really were no supports. I was on the faculty at Harvard Medical School at the time. We started a program that I was fortunate enough to lead where most of the childhood cancer patients and long-term survivors, we followed them, I followed them. And we kept meticulous registries. The course, the risk factors, and the validation of biomarkers has been a focus of how do we learn from our patients that are first generation. Successful treatment of childhood cancer in 1970 was really no better than what it was in the 1940s. Only 4% of children with leukemia 5 years out were disease-free and cured. And now, for that same childhood leukemia patient, in some centers, it's more than 90% are cured of their cancer. It's enabled us to tailor therapies in a more specific way to improve the quality of life of that child over a lifespan. All of their study data is brought together in one set of central databases, and that can enable us to make adjustments. And that's in contrast to adult oncology, where probably only about 10 or 15% of all adults newly diagnosed with cancer are treated on cooperative group protocols, much smaller number. And a lot of the pediatric toxicities or problems that children face with their hearts, it doesn't necessarily happen during treatment. It's as they are 5, 10, 15, 20 years out. We continue in most programs to continue to follow these patients through their lifespan because we continue to learn from this first generation of long-term survivors. If you don't look, you don't know. So we learn by looking and we learn by following.